Now, what sort of investigations do we do when patients present with symptoms? Firstly, of course, about 20% of all colon-rectal cancers present within reach of the finger. So your doctor will want to do a finger examination of the anus. Following that, we would want to do a colonoscopy to check if the symptoms are indeed from a tumor in the colon or rectum. Now, once a tumor is diagnosed in the colon and rectum, we will want to do other investigations to look at the spread beyond the colon and rectum. For example, in the lymph nodes around the colon or rectum, and also looking at the liver and lungs and so forth to see if there's spread outside the confines of the intestine. We also do a blood test looking at cancer markers. Now, these cancer markers are not needed for treatment, but they are useful for follow-up, because if a patient has high cancer markers before surgery and after surgery the tumor markers drop, then we know that we can use these cancer markers in the process of follow-up. If the cancer markers rise again on follow-up, then we have to do further tests to see if indeed cancer has recurred. But if the cancer markers remain low, then we would be happier and the patient also would be happier. Okay, so how do we actually treat colorectal cancer? The treatment of colorectal cancer depends obviously on where the cancer is and how large it is. Advanced cancers are sometimes treated only with radiotherapy and chemotherapy, but all potentially curative colorectal cancer needs to have surgery for complete clearance and to ensure that all tumors are removed. Now, over the last decade or so, many new modalities of treatment for colorectal cancer has come into availability for the surgeon to help the patient recover better and to better ensure a complete resection of the tumor. In the old days, all patients with cancer of the colon and rectum needed a large incision to remove the segment of colon plus the surrounding fat, what we call the mesocolon or mesorectum, in which lymph nodes reside. This had to be removed completely to ensure a cure. New methods, for example, keyhole surgery or what we call laparoscopic surgery, has come into play. In laparoscopic surgery, all we need is to have 3 or 4 small holes where we can remove the colon completely together with the mesorectum and mesocolon. We're able to join the colon together again so that patients are able to pass motion normally through these small keyhole methods. Other important new modalities of treatment include the use of the robot and even what we call reverse total mesorectal excision or transanal surgery, where we are able to remove the tumor totally through the rectum. These new modalities are very helpful for the patients because they enhance recovery, they speed up recovery, and patient can return to work much faster than it would in the past. Other therapy may be needed, for example, radiotherapy or chemotherapy, and we would decide on this therapy based on the stage of the tumor and based on where the tumor is situated. So, colorectal cancer is not a death sentence. Colorectal cancer can be prevented from happening if one undertakes screening before symptoms occur and at an earlier age than the high-risk age group that most cancers occur in. Secondly, even if colorectal cancer has occurred, do not worry, because there are now many methods of treatment which can effectively cure these cancers and return patients to a normal state of health and normal state of life. So do not worry. Colorectal cancer can be prevented, it can be treated, and can be treated early, and the new methods of surgical treatment ensures that patients have a faster recovery and an earlier return to normal work and normal living. I'm Dr. Francis Seow. I hope my video today has enlightened you on some aspects of colorectal cancer. I wish everyone good health and long life. Thank you very much.